still on hyperemesis gravidarum, or excessive nausea and vomiting in pregnancy. And this is a reply to Fruitful Babe, who asked if hyperemesis gravidarum can be prevented. Unfortunately, hyperemesis gravidarum cannot be prevented. There are a couple of things that can increase the risk or chances of a woman experiencing this. One, if she's a young woman, so someone who is, in their 20s or early 30s becoming pregnant, could have this condition. If it's her first pregnancy, she's at increased risk of having hyperemesis gravidarum. If she's had hyperemesis gravidarum in a previous pregnancy, so let's assume this is her second or third pregnancy, and in a previous pregnancy she had, severe nausea and vomiting, there's a likelihood that she could have it in her current pregnancy. If she has a family history, so if someone in her family, especially if it's a first degree relative, a sister or a mom, has had or had hyperemesis gravidarum in their pregnancy, then that lady is at increased risk of having hyperemesis gravidarum. If she has a high BMI, so if she's overweight or obese, she's at increased risk of having hyperemesis gravidarum. If she experiences motion sickness or any other nausea and vomiting problems, maybe she has a gastrointestinal problem, in her bowels, her intestines, or she has a problem with her balance system in her ears or brain, then she can be, she will be at increased risk of having hyperemesis gravidarum. There are so many other things that can increase a woman's chances of having hyperemesis gravidarum, but these are just a couple that are well established or well known. Now, in terms of what can be done to manage this condition, when we identify that a woman is having this problem, we usually start her on medications, anti-sickness medications or anti-vomiting medications like meclizine or cyclizine to suppress that vomiting. We encourage her to drink water, very small amounts, but more frequently. Eat very small amounts but more frequently, because if you drink large amounts of water or eat large amounts of food at a time, then obviously you could vomit, and that would just be like a vicious cycle. Some people have found that eating ginger and drinking ginger juices helps reduce the symptoms. And obviously if the woman is becoming very unwell, she's not able to stop vomiting, she's not able to to keep her fluids and food down, she'll have to be admitted to the hospital, where she'll be treated with fluids given through her veins and some other medications that she'll be given to reduce her risk of having blood clots. For instance, she'll be given some blood thinner medications. And if she's becoming very much unwell, then the things I mentioned in the previous video, like she might be admitted to the intensive care, or then that final decision, which is a very unpleasant decision, may have to be